So it's hard for parents to understand and to remember or to know that our emotions, our feelings, our behaviors are actually regulated by our brain. And our brain, as our arm or our leg, is an organ that needs care. It needs care and it needs attention. So, you know, how does our brain become injured? What happens to us when we have these behaviors and these problems? Where does that come from? So some of it is genetic. Some of what happens to children when it involves mental illness is genetic. A lot of it, though, a lot of what we're seeing in the community is related to trauma and exposure to trauma. And exposure to trauma can happen from the day you're born. So it could happen at birth. It could happen with perhaps a poor attachment with a mother who's really depressed. And we often think that that doesn't translate to the infant child, but the infant child experiences depression as well. The children in this community are exposed to trauma on multiple levels. So it could be trauma related to family violence. It could be trauma related to community violence. And it could be trauma related to immigration and the immigration process. And simply what it's like to come to a new country and experience all that that entails. Oftentimes, many of the kids we see are coming after their parents, after years of separation from their parents. So those changes in acculturation and the different levels of acculturation between parent and child often is what brings a child to us.